well, not a collapse. A collapse is too severe. Yin deficiency, generally speaking. Generally speaking, you know, we're shrinking because there's less fluids. What's the big rave in Hollywood now? Injections. Injections. What are we putting into our face to look better? Michael Jackson. Well, Botox, but now, you know, it's Restylane and all of these fluids. Instead of the lift, instead of the surgery, they're reconstructing with injections. Why? Because we're losing our fluids, okay? We're losing our collagen, our elastin, we're losing all that. The older you get, even when you don't have wrinkles, it's not as plump. You know, when you look at your picture when you were 14, and just something it's fuller. Your face is fuller. The older you get, we're losing the yin, which can be collagen, elastin, it can be all of this stuff, right? Yeah? The older you get, you know, things to look forward to. I can hardly wait to get my scooter.
There you go.
I want a nice red, what is it, fire engine red one. Okay, dampness. What does dampness have? So think about the characteristics of dampness. Mold, okay, but the first thing that comes to mind, remember I told you someone that's damp, that has dampness, is usually someone that is overweight. They're carrying a lot of dampness. Okay, and what was the point I said that would help that? Stomach 40. Stomach 40. Make sure you know where that is. So dampness, the characteristics are heaviness, right? Heaviness, turbidity. What is turbid? If something is turbid, what does that mean?
Turbid.
Okay, the opposite of clear. Okay, so something is clear, something is turbid. Okay, when you have a lot of dampness, what can happen? Stagnation. What does stagnation mean? It's not flowing, it's not moving, it's not circulating. Okay. So we can have yin evil, which damages yang and obstructs qi circulation. So generally speaking, without going all into the TCM verbiage, when you have dampness, it can create obstruction, channel obstruction. Okay? Dryness. What causes dryness? Too much fire. Like if you're, you know, in a really hot climate, what happens? Think of a desert. Okay? And you have cracks. And you'll be able to see also with yin deficient tongues, what will you see if there's not, you know, there's no coating? What else will you see often? Cracks. Like a desert. Cracks. And also you'll see it with skin.
You see people's feet all the time, eh?
And feet, yeah. Okay, so these are things that are some of the characteristics. Dryness consumes body fluids, but it can also damage what organ? Lungs. And we will learn more about the lungs, but just to give you a general idea. Okay? And we know what happens if you have dry lungs. What's the symptom? Or if there's dryness? You cough, right? There's some dryness. There's like coughing. Now, the lungs, according to Chinese medicine, is also connected to the largest organ in the body, which is what? The skin. The skin.
Right.
So, dryness. Okay? Now, this is called the 6 environmental factors. So any examination you take for TCM, this is what it will be called, okay? They're environmental factors, and you need to know them, okay? Okay, now we have the last one is fire. So what does fire do? It eats up everything. It consumes also the fluids. Okay? The motion is upward motion, okay, and burning. And it produces wind and causes disturbances in the blood. Okay. I'm going to do a little, like some few case studies, because again, we're talking about concept today. Doesn't matter if you don't know it or understand it fully, but I just want to give you a general idea of how we would work. For instance, if someone has, first of all, fever, what does that tell you? What environmental factor?
Fire.
Okay. Fever, sweating, cough, aversion to wind, numbness of limbs, itching, convulsions,
Dampness.
rigid contraction of a lot of the body muscles. The tongue is white coat, so it's white coat. And the pulse is slow. So, this is only an example to show you how we're going to work. Okay? You have all of the symptoms. You write them down. Okay? You have all of the symptoms. Once you've taken all your inventory, which... Okay. Then you have your diagnosis according to TCM. And you must always tell this to your patient, because legally you can't diagnose. But with Chinese medicine, as far as I know, legally I can diagnose. But I say, according to Chinese medicine, or according to TCM, this is what you have. So, let's say their TCM diagnosis, okay? Let's say it's wind cold. So you say wind cold. Then you have your treatment principle. The treatment principle says what you will do. I'm just showing you how logical this is. So if they have wind cold, you're going to resolve the cold and the wind. Okay? You understand? So let's say someone has, the very favorite is liver qi stagnation. And I'll just tell you the symptoms very quickly. Irritable, because liver, you know that liver, it deals with anger, irritability, some depression also. Hypochondriac pain. Now that was in your notes of terms. Hypochondriac is right under the breast. On both sides it can be hypochondriac pain. Okay? And let's say a little twitching, just to give you everything, a lot of things that have to do with the liver. Okay? And also tired and depressed. So that's liver qi stagnation. Okay? The liver is not moving smoothly. The liver qi is not moving smoothly. Okay? So, our TCM diagnosis, on your form you would do TCM diagnosis, liver qi stagnation. Following that you have treatment principle, smooth liver qi. Okay? So you know exactly the cause, you know what you're going to do in words, and then you have your point prescription. Okay? So see how systematic it is? Once you have your point prescription, then you have your herbal prescription. Now, this comes after your everything you've learned in acupuncture, right? So you already have your questions that you've done, right? You ask do you have your form, and it has those questions, you know, your diet, urination, you know, energy level, eyesight,
General
ears.
intake.
Huh?
The general intake
Yeah,
form.
you have your general, okay, so you take that. So do you have, after that, you have your treatment principle? Okay. So you have your TCM diagnosis, your treatment principle, then your acupuncture point prescription, then you have your herbal prescription, and after that you may have your Tuina prescription. And when really done properly, every move is logged in. every move, okay? And we'll get to that when we, but it's very systematic. It's very systematic. Okay, so just going over, if someone has summer symptoms with fever, sweating, lassitude. What does lassitude mean? Because you'll see this in a lot of books on TCM. What does lassitude mean? Lassitude. Tiredness, right, okay. Yellow urine. Now what is yellow? If it's a deep yum yellow urine, what what is
Lack of
that?
water.
Huh?
It would be a lack of water, fluid.
Yellow urine?
Fire.
Heat.
Heat,
Heat,
yeah.
okay. If it's white urine, that's what?
Cold.
Generally, okay, we're talking about concepts now, okay? So yellow urine, profuse sweating, tongue is red with yellow coating, pulse is rapid, so that tells you there are some heat conditions happening, okay? So you have your treatment principle, which is summer heat, according to what I've just told you, and then your acupuncture prescription, then you have your herbal prescription, and your Twina prescription following that. Okay, let's go to dampness. So what did we say the dampness, when someone has a lot of dampness, they'll feel, what? They will feel full and heavy, okay? So feeling of fullness and heavy in the chest, can have a headache, heaviness in the body, some pain, restriction in joints, tired, no thirst, fever, copious clear urine. Why isn't there no thirst?
Because they're already damp. They're
Good.
already wet.
Isn't it simple? Very simple.
What means
Oh.
copious?
Lot.
A lot.
Oh,
Like a lot. Plentiful.
okay.
So treatment principle, would be to transform dampness, okay, or relieve dampness, dry dampness. Okay. Let's go to dryness. Cough, nasal congestion, aversion to cold. You will see this: aversion to heat, aversion to cold. What does aversion mean? Not wanting to, avoid, yeah. So if someone's cold, they're not going to want to go into a cold room. They're, you know. The tongue in a cold symptom would be white. Here it's dry, okay? And a floating pulse, meaning it's close to the surface. It's not rapid. Okay, so